In the modern world, mental health is becoming an increasingly significant topic. Millions of people daily face anxiety, depression, and other psychological problems, yet access to qualified help is often limited. A shortage of specialists, high session costs, and geographical barriers all create a chasm between the need for psychological support and its availability. It is against this backdrop that artificial intelligence begins to play a revolutionary role in the field of mental health. Digital therapists, working around the clock, 7 days a week, and without geographical limitations, are already helping millions of users cope with everyday emotional difficulties. But can an algorithm truly understand human emotions? Can a machine provide the depth of empathy necessary in the therapeutic process? What advantages and limitations does this technological revolution bring for patients and specialists? These questions are becoming central to the discussion about the future of psychotherapy. The history of artificial intelligence in psychotherapy begins in 1966, when Joseph Weizenbaum created the ELIZA program, the world's first chatbot, mimicking a Rogerian psychotherapist. This primitive algorithm simply rephrased user questions and returned them in the form of new questions. But even such simple mechanics produced a surprising effect. People began to attribute understanding and empathy to the program, revealing deeply personal experiences to it. Weizenbaum himself was shocked by how quickly users formed an emotional connection with the machine. This phenomenon, later named the ELIZA effect, laid the foundation for all subsequent developments in digital psychotherapy. In the 80s, more complex systems emerged, such as Depression 2.0, capable of conducting structured interviews to assess depression symptoms. The 90s and 2000s were marked by the appearance of the first online platforms for cognitive behavioral therapy, operating according to predefined scenarios. The real breakthrough occurred with the development of machine learning and neural networks in the tens of the 21st century. Systems like Woebot, launched in 2017, could already analyze user mood, adapt therapeutic techniques, and maintain a more natural dialogue. Interest in these technologies sharply increased during the pandemic, when a global mental health crisis collided with the physical impossibility of in-person consultations. Over the past 3 years, investments in the digital mental health sector have quadrupled, reflecting the growing need for accessible solutions. The market for AI solutions in mental health support is rapidly growing, offering users a diverse range of digital therapists. One of the pioneers in this field is Woebot, a chatbot developed by clinical psychologists at Stanford University. This virtual therapist utilizes principles of cognitive behavioral therapy, helping users track their mood, recognize negative thought patterns, and apply mindfulness techniques. Daily short dialogues with Woebot enable the integration of therapeutic practices into everyday life. Another popular assistant is Wiza, a fluffy penguin companion that combines elements of cognitive behavioral therapy with dialectical behavioral therapy and mindfulness practices. The replica application goes even further, creating a virtual friend that adapts to the user's personality, remembers their preferences and interaction history, forming unique relationships. Modern AI therapists are not limited to text chats. Voice assistants, such as Tess by X2 AI, allow for therapeutic conversations in an audio format, which is especially valuable for people with disabilities or those who prefer oral communication. The most innovative solutions integrate virtual reality, creating immersive therapeutic spaces for treating phobias and anxiety disorders. Users can gradually confront frightening situations in a safe virtual environment under the guidance of an AI therapist, who monitors physiological reactions through wearable devices. The revolution in the accessibility of psychological care. This is what the introduction of artificial intelligence in the field of mental health brings with it. In a world where over 4 billion people live in regions with a critical shortage of psychologists and psychotherapists, digital solutions are becoming not a luxury, but a necessity. According to the World Health Organization, in some African countries, there is less than one mental health specialist per 100,000 people. Even in developed countries, the situation is far from ideal. Waiting times for appointments can stretch for months, and the cost of a session remains an unaffordable luxury for many. AI applications break down these barriers with a single touch of the screen. Geographical accessibility ceases to be a problem. A virtual therapist works in the most remote corners of the planet, where there is at least basic internet access. The financial barrier is also significantly reduced. Most applications offer basic support for free or at a price tens of times lower than traditional therapy. Time constraints disappear completely. A digital assistant is available at any moment when it is truly needed. Statistics speak for themselves. Over the past 2 years, the number of interactions with AI therapists has grown by 300%. This growth is particularly noticeable among young people, rural residents, and representatives of socially vulnerable groups, those who traditionally had the least access to psychological care. In countries with high levels of stigmatization of mental health issues, the anonymity of digital solutions becomes a key factor, allowing people to seek help for the first time without fear of judgment. For many users, an AI therapist becomes the first step on the path to acknowledging a problem and seeking professional support. The advantages of artificial intelligence in psychological support are truly revolutionary. 24-hour availability becomes a lifesaver in critical moments. At 3 in the morning, when anxiety peaks, an AI therapist is always ready to listen and offer support, unlike a human specialist. This feature literally saves lives. Research shows that timely support at the moment of crisis reduces the risk of suicidal thoughts by 40%. Another undeniable advantage is the complete absence of judgment. AI does not experience fatigue, irritation, or bias, which creates a safe space for discussing shameful or taboo topics. For many users, it is easier to confess an addiction or intrusive thoughts to an algorithm than to a human. Anonymity and confidentiality become key factors for people from conservative communities or public professions. Personalization of therapy reaches a new level thanks to AI's ability to analyze huge amounts of data. Modern systems track speech patterns, emotional fluctuations, behavioral triggers, and adapt the approach to the unique needs of each user. Economic efficiency is also striking, with comparable effectiveness in treating mild and moderate forms of depression. AI therapy is tens of times cheaper than traditional therapy. The story of Maria from Siberia illustrates the potential of these technologies. Living in a remote village without access to specialists, she was able to overcome panic disorder with the help of an AI application that offered daily exercises and tracked progress. After 3 months, the frequency of panic attacks decreased from 5 per week to 1 per month, which radically improved her quality of life. Behind the outward brilliance of technological innovations lie fundamental limitations that call into question the very possibility of full-fledged AI therapy. The main problem lies in the absence of genuine empathy. Even the most advanced algorithms only imitate understanding, creating an illusion of human contact. A machine analyzes speech patterns and selects statistically probable answers, but is incapable of truly sharing a person's pain. Professor of clinical psychology at Stanford University, Adam Mathers notes, "Limited understanding of context is another critical drawback. AI often misses cultural nuances, personal history, and non-verbal cues, which constitute up to 70% of human communication. Ethical problems cause no less alarm. Confidentiality becomes illusory. Data about users' most intimate experiences are stored on company servers vulnerable to hacking. Blurred responsibility for recommendations creates a dangerous situation where neither developers nor the algorithm bear legal responsibility for potential harm. Of particular danger is AI's inability to adequately respond to crisis situations. A delay in recognizing suicidal intentions can cost a life. Psychiatrist Jane Kowalski warns, excessive reliance on digital assistants can atrophy live communication skills, exacerbating social isolation, the root of many psychological problems. The scientific community is actively investigating the effectiveness of AI therapy, and the results inspire cautious optimism. A large-scale Stanford University study encompassing 2,000 participants with mild to moderate depression symptoms showed that 80% regularity in using the AI application Woebot over 8 weeks led to a 32% reduction in symptoms, a result comparable to some pharmacological interventions. Systems operating on cognitive behavioral therapy principles show particularly impressive results in treating anxiety disorders. A meta-analysis of 11 clinical trials published in Nature Digital Medicine revealed that AI therapy achieves 60% of the effectiveness of traditional methods for generalized anxiety disorder. However, studies on PTSD and complex depressive states show much more modest results, only 25% effectiveness compared to a human therapist. Methodological limitations of existing research provoke justified criticism. Columbia University professor of psychiatry Maria Lee points to systematic sample bias. Study participants are predominantly technologically literate individuals who are initially positively inclined towards digital solutions. Another problem is the high dropout rate. Up to 70% of users cease interaction with an AI therapist within 2 weeks. The scientific community is divided into optimists, who see AI therapy as the future of preventive psychology, and skeptics, who consider the technology merely an auxiliary screening tool. The future of psychotherapy lies not in the opposition of human and machine, but in their harmonious cooperation. The model where artificial intelligence acts as an assistant to the therapist rather than a replacement shows the greatest promise. The Mayo Clinic, in collaboration with IBM Watson, has already implemented a system that analyzes session notes and suggests personalized techniques to the therapist based on identified patterns in the patient's speech. Psychologists note that this approach allows them to see non-obvious connections and trends, accelerating the therapeutic process by 20%. AI assistants demonstrate particular value in inter-session monitoring. The MindStrong app analyzes smartphone usage patterns, typing speed, error frequency, navigation patterns, and can detect signs of an impending depressive episode 2 weeks before overt symptoms appear. The therapist receives a notification about the client's potential deterioration and can take preventive measures. Professor of psychiatry at Harvard University David Morris emphasizes, AI takes on the routine aspects of the work, allowing us to focus on what truly requires human presence, deep understanding, and emotional connection. Clinical trials at Massachusetts General Hospital showed that integrating AI assistants into practice increases the effectiveness of cognitive behavioral therapy by 34%, especially in cases of resistant depression. The future of psychotherapy belongs to personalization and adaptability. qualities that artificial intelligence is developing at an incredible pace. Modern machine learning algorithms are already capable of analyzing thousands of user interaction parameters, creating a truly individualized approach. DeepMind is developing a therapeutic system that takes into account not only the client's direct requests, but also their cultural background, linguistic features, even the time of day and weather in the user's region. This opens a new era in psychotherapy, where help adapts to the person, not the other way around. Predictive analytics is becoming an especially promising direction. Researchers from the Massachusetts Institute of Technology have created an algorithm capable of predicting depressive episodes 2 weeks before their onset, based on changes in user voice patterns. This allows a shift from a reactive therapy model to a preventive one, where intervention occurs before the condition worsens. The integration of biometric data opens entirely new horizons. Experimental systems are already connecting data from smartwatches, tracking heart rate, sleep quality, and activity levels with therapeutic algorithms. Stanford University neuroscience professor Elizabeth Chen states, "When an AI therapist gains access to physiological markers of stress, it will be able to intervene at moments when a person is most receptive to help, even if the user themselves has not yet realized their state." The professional community of psychologists and psychotherapists is divided in its assessments of the role of artificial intelligence in the future of therapy. Dr. Alan Couzens, head of the American Psychological Association, presents an optimistic view. AI will be a democratizer of psychological care, allowing us to reach millions of people who would otherwise never receive support. It is not a replacement for therapists, but an expansion of our toolkit. Professor Elena Sokolova from Moscow State University takes the opposite position. Therapy is primarily about relationships. No algorithm is capable of creating a genuine therapeutic bond, which in itself is healing. Between these poles lies the pragmatic position of Dr. John Taylor from the London School of Economics. The question is not whether AI will replace psychologists, but how psychologists using AI will replace those who do not. This opinion reflects a growing understanding of the need for professional transformation. Leading universities are already introducing courses on digital psychology and the ethics of using AI in therapy. Professor Lin Zhao of the National University of Singapore predicts, "In 10 years, a psychotherapist without the skills to work with AI assistants will be like a modern doctor without knowledge of antibiotics. Technically possible, but practically ineffective." With the development of artificial intelligence in psychotherapy, a critical question arises: how to ensure the safety and quality of such systems? Today, we observe a regulatory vacuum. Most AI applications for psychological support exist in a gray area between entertainment products and medical devices. The European Union is taking its first steps towards regulating this field through the Artificial Intelligence Act, where psychological support systems are classified as high risk, requiring certification and regular audits. In the US, the Food and Drug Administration is developing a separate category for digital therapeutic devices, which includes AI applications for mental health. Japan has gone further than anyone, creating a specialized agency for the certification of therapeutic AI systems, requiring evidence of clinical effectiveness before market release. A key problem remains defining the boundary. When does a wellness application become a medical tool? Dr. Maria Schultz of the World Health Organization proposes a simple criterion. If a system claims to be able to help with specific diagnoses, it should be regulated as a medical device. The question of responsibility also requires immediate resolution. Who bears the legal consequences if an AI therapist fails to recognize suicidal intentions or gives dangerous recommendations? Developers insist on a limited liability model, citing the statistical nature of AI, while human rights advocates demand strict safety standards similar to the pharmaceutical industry. Summarizing our journey into the world of artificial intelligence in psychotherapy, we arrive at the main conclusion. The future lies not in the confrontation between man and machine, but in their harmonious collaboration. The complementary model, where AI supplements the work of a specialist rather than replacing them, shows the greatest effectiveness and promise. Technologies expand the capabilities of therapists, take on routine tasks, and provide continuous support between sessions, while human specialists bring the irreplaceable, genuine empathy, a creative approach, and a deep understanding of the human soul. We stand on the threshold of a new era of psychological assistance, where every person, regardless of location and financial means, can receive support tailored to their unique needs. However, this path requires caution and responsibility. The development of technologies must be guided not only by the capabilities of artificial intelligence, but also by the real needs of patients, ethical principles, and scientific data. The balance between innovation and the preservation of the human dimension in therapy, this is the key challenge and the main value of future psychotherapy. In this balance lies the potential for creating a truly holistic system of psychological assistance, capable of responding to the global mental health challenges of the 21st century.